Testosterone is a hormone. It plays a key role in male health. It is responsible for muscle mass. It also impacts sex drive and sperm production. Testosterone levels naturally decline with age. This is a normal part of aging. However, significantly low levels can lead to various health issues. It is important to recognize the signs. Early detection and treatment are crucial. Testosterone is essential for men's overall well-being. It contributes to physical and mental health. It affects energy levels and mood. Maintaining healthy testosterone levels is important throughout life. A balanced lifestyle can support hormonal health. Testosterone is produced in the testes. The pituitary gland regulates its production. This gland is located in the brain. When testosterone levels drop, the pituitary gland signals the testes. This signal tells the testes to produce more testosterone. This feedback loop ensures hormonal balance. Understanding the role of testosterone is crucial. It helps us recognize potential imbalances. It allows us to take proactive steps for our health. By being aware of the signs and seeking timely medical advice, men can maintain their vitality. Recognizing the signs, common symptoms of low testosterone. Low testosterone, also known as hypogonadism, can manifest in various ways. Recognizing the symptoms is the first step towards addressing the issue. Common signs include reduced sexual desire and erectile dysfunction. Men may also experience fatigue and low energy levels. Physical changes are also indicative of low testosterone. These include decreased muscle mass and increased body fat. Men may notice a decline in bone density, leading to a higher risk of fractures. Hair loss on the scalp and body is another visible symptom. Emotional and cognitive changes are not uncommon. Men with low testosterone may experience mood swings, irritability, and depression. They might find it difficult to concentrate or remember things. These symptoms can significantly impact quality of life. If you experience any of these symptoms, it's essential not to ignore them. While they can be attributed to other conditions, it's crucial to consult a doctor. They can determine the underlying cause and recommend appropriate treatment options. Behind-the-scenes causes and risk factors. Low testosterone can stem from various factors. Sometimes the testes don't produce enough testosterone. This is known as primary hypogonadism. It can be caused by genetic conditions, infections, or injury to the testicles. In other cases, the problem originates in the brain. The pituitary gland or hypothalamus may not send the right signals to the testes. This is called secondary hypogonadism. Tumors, infections, and certain medications can contribute to this condition. Certain risk factors increase the likelihood of developing low testosterone. Age is a significant factor, as testosterone levels naturally decline with time. Obesity, chronic illnesses like diabetes, and unhealthy habits like smoking can also play a role. Understanding the causes and risk factors empowers individuals to make informed decisions. By addressing modifiable risk factors, men can potentially mitigate their risk. It's important to discuss any concerns with a healthcare provider. Seeking answers. Diagnosing low testosterone. Diagnosing low testosterone involves a multifaceted approach. Doctors typically begin by reviewing the patient's medical history. They inquire about symptoms, lifestyle habits, and any existing medical conditions. A physical examination is also conducted. Blood tests are crucial for confirming the diagnosis. They measure the levels of testosterone in the bloodstream. These tests are usually performed in the morning when testosterone levels are highest. Multiple tests might be necessary for an accurate diagnosis. Additional tests may be recommended to pinpoint the underlying cause. These may include imaging scans of the brain or testicles. Genetic testing might be necessary in some cases to identify any inherited conditions. Diagnosing low testosterone requires a comprehensive evaluation. It's important to consult a qualified healthcare professional. They can interpret test results and recommend the most appropriate course of action. Treating low testosterone often involves testosterone replacement therapy, or TRT. TRT aims to restore testosterone levels to a healthy range. This can alleviate symptoms and improve overall well-being. TRT is available in various forms, each with its pros and cons. Injections are a common method of TRT. They deliver testosterone directly into the muscle where it is gradually released into the bloodstream. Patches and gels are transdermal options that deliver testosterone through the skin. These methods offer convenience but may cause skin irritation in some individuals. Other forms of TRT include buccal tablets, which are placed between the gums and cheek, and implantable pellets which release testosterone over several months. The choice of TRT method depends on individual needs, preferences, and medical history. It's important to note that TRT is not suitable for everyone. It's crucial to discuss potential risks and benefits with a healthcare provider. They can determine the most appropriate treatment plan based on individual circumstances. While medical treatments like TRT can be effective, lifestyle modifications also play a crucial role in managing low testosterone. Adopting a healthy lifestyle can naturally boost testosterone levels and improve overall health. These modifications involve making conscious choices about diet, exercise, and sleep. Maintaining a healthy weight is paramount. Obesity is closely linked to low testosterone. Shedding excess pounds can significantly improve hormonal balance. A balanced diet rich in fruits, vegetables, lean protein, and healthy fats fats is essential. Regular exercise is another cornerstone of a testosterone-boosting lifestyle. Engaging in strength training and high-intensity interval training, or HIIT, can stimulate testosterone production. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. Adequate sleep is crucial for hormone regulation. Most adults require 7-9 hours of quality sleep per night. Prioritize sleep hygiene by establishing a regular sleep schedule, creating a relaxing bedtime routine, and ensuring a dark, quiet, and cool sleep environment. Early detection and treatment of low testosterone are crucial for preventing long-term complications. Untreated low testosterone can increase the risk of various health problems, including cardiovascular disease, osteoporosis, and type 2 diabetes. Moreover, low testosterone can significantly impact mental health and quality of life. It can contribute to depression, anxiety, fatigue, and reduced cognitive function. Addressing low testosterone promptly can improve mood, enhance energy levels, and boost overall well-being. Regular checkups with a healthcare provider are essential for early detection. Men experiencing symptoms of low testosterone should not hesitate to seek medical advice. Early intervention can make a significant difference in preventing complications and maintaining optimal health. By prioritizing their health and seeking timely medical attention, men can effectively manage low testosterone and live healthier, more fulfilling lives. Remember, knowledge is power, and taking proactive steps towards managing your health is always the best course of action. When to consult a doctor. Recognizing the signs and symptoms of low testosterone is crucial, but knowing when to consult a doctor is equally important. If you experience persistent fatigue, reduced libido, erectile dysfunction, or other symptoms associated with low testosterone, it's essential to schedule an appointment with your healthcare provider. Don't dismiss these symptoms as simply a part of aging. While testosterone levels naturally decline with age, a significant drop can indicate an underlying medical condition. Your doctor can assess your symptoms, conduct necessary tests, and determine the underlying cause. Remember, you are your own best advocate when it comes to your health. Don't hesitate to seek medical advice if you have concerns. Early detection and treatment can make a significant difference in your overall well-being and quality of life. Your doctor is your partner in health. They can provide guidance, support, and advice. Personalized treatment options to help you manage low testosterone and improve your overall health. Low testosterone is a common condition that affects millions of men. While it's often associated with aging, it can occur at any age and is often treatable. Understanding the symptoms, causes, and treatment options is crucial for taking charge of your health. If you suspect you might have low testosterone, don't hesitate to consult a healthcare professional. They can provide a proper diagnosis, recommend appropriate treatment options, and guide you toward a healthier, more fulfilling life. Remember, you don't have to navigate this journey alone. By prioritizing your health, seeking timely medical advice, and adopting a healthy lifestyle, you can effectively manage low testosterone and reclaim your vitality. Take charge of your health today and embrace a brighter, more energetic tomorrow. If you have watched until the end of this video and think you've learned anything new or anything of value, please don't forget to press the like button and subscribe to the channel to stay up to date with all the videos. Don't forget to press the bell icon as well. Stay safe, stay healthy,